Hi, everyone. Welcome to GINA's virtual Nurse Practitioner Week celebration. I'm Deepthi Verghese, President of Georgia Indian Nurses Association. Thank you for joining us on our second interactive Q&A session this week. We are very excited to have another leading nurse practitioner from Georgia, Ashley Blackmon.
Hey, everybody. Thank you for having me.
Hi, everyone. I'm Jensine. I'm the APRN chair for GINA. So as Deepthi said, our guest speaker for today is Ashley Blackmon. So to tell you a little bit about her, she's a board certified nurse practitioner, and she currently sees advanced heart failure patients in both the clinic and hospital setting. She has been in her current position for over 6 years. She earned her BSN and MSN from Georgia State University in Atlanta. Her healthcare tenure spans almost 2 decades and ranges from ER technician to bedside ICU nurse in med-surg as well as neurotrauma. She also did research nursing for Altea Therapeutics. She obtained her CCRN certification and trauma nursing course certifications during her bedside tenure. Her graduate experience ranges from outpatient pediatric management to inpatient heart failure cardiology. She obtained her CHFN, which is a heart failure certification, in September 2020. And she's also a member of the American College of Cardiology, the Heart Failure Society of America, the American Association of Heart Failure Nurses, and she serves as president-elect of UAPRN of Georgia. She was recognized as one of Georgia State's 40 under 40 in 2019 for her many publication and volunteer efforts. So she clearly has a very extensive background, so we're very lucky to have her here. And today's topic is on transition from nurse to provider. This topic is actually really important to me because I'm actually in my first year transitioning from nurse to provider. So I'm really excited to hear what Ashley has to say today. So our first question for you is, what was your experience like when you transitioned from nurse to provider?
Well, if I could change there we go. I need to change my screen. It was terrifying. That was when I read this question, that was the first thing that came to mind, was that I was really, really, really scared. I was excited, but it was also terrifying. I initially studied family nurse practitioner and started a family nurse in a family practice they were open partial hours, like half days on the weekends, and did some urgent care aspects. So there was a lot to learn. There was a lot to do. There was an x-ray, the ability to take x-rays on site. And obviously every x-ray was sent to a radiologist to review, but it was there for us to review initially in case there was anything major that we could treat in the moment. And so it was very overwhelming and terrifying. And it was one of the biggest challenges of my life, I would say.
Hey, Ashley. So how long did it take for you to get comfortable in your new role as a provider, and then again as a heart failure nurse practitioner?
So my first role that I was only in for about 9 months. And I still don't feel like I was comfortable. The next role I was in with a gastroenterology position, I left after 2 years, and it was interesting because I felt like I had finally started getting comfortable. And then with advanced heart failure, it's definitely a much steeper learning curve, being going general to specialty to then subspecialty. But it was, I'd say, probably another 2 years. There's always things changing about my role since I see LVADs, which are heart pump patients, and heart transplant patients. And so that data is always being updated. So there's always something changing. So learning how to stay up to date while also being comfortable with assessment skills and other things like that is ever evolving. But I feel really confident in my position now that I've been there 6 years, but I'm just saying there's always still something to learn. So I would say probably 2 years is probably how long it took me every time I would change jobs to start feeling at least competent enough to not kill somebody. Is how long it would take me.
So in your opinion, how many years of experience should nurses obtain before becoming an NP? I know you had a good bit of nursing background experience.
So I feel like this is a very controversial question because there's the ability to do anything. You could go straight through, you can be at bedside for 20 years, who knows? But in my opinion only, and I have no data to back it up, is that I think 2 years is a good amount of time to spend as a bedside nurse. I feel like the critical thinking skills and the time management skills and just the exposure to bedside and the nursing role and how we differ from the medical model in that we're more patient centric. You can't get that without spending 12 hours at a bedside, maybe 8 hours depending on where you work, but it's just, I feel like our perspective is so different just because of that experience, and I think it's an important experience to have.
Thanks. In what ways did your nursing experience help you in your role as a provider?
I think I might have touched on a couple of those things. I felt like it really, so I was one of those people, I know that nursing is incredibly diverse, and I love that about our profession. And I feel like a lot of people, nursing is a second or third or fourth career choice. But I was one of those people where I ended up taking a very short hiatus and between figuring out what I was wanting to do with my life before I changed majors into nursing, and then did an accelerated program at Georgia State. So I was still in my early 20s. I was still very new to just the world when I became a nurse, and it changed who I am fundamentally as a person. Just I came from a very sheltered background, and then to go from that to working in a trauma ICU in a at a in a major city, just not only developed me clinically and in a career, but also developed me as a person, and just it changed my worldview, and it changed a lot about me fundamentally, and so I think that without that foundation, I never would have gotten to where I am without that, and I would have lived a very different life. And so I think that my nursing experience has been invaluable in not just shaping my career, but shaping who I am.
Interesting perspective. You mentioned earlier that your first couple years as a new provider was pretty challenging. What are your thoughts about NP residencies and fellowships for both primary care and specialties?
I love that you asked this question because I don't think that I'm over here thinking we must have this. Why do we not have this? But those things are invaluable. One of the things that everybody, not just healthcare professionals, have discussed ad nauseum without coming up with any real solutions is how broken our healthcare system is, via the lens of the pandemic, what has shown us. And so to look at the medical model and say, well, they have this, so maybe we should have it too, is not necessarily the answer, because residencies and fellowships are very expensive. They're very time consuming. They're a burden on the the hospital system or institution that utilizes it without being able to guarantee that they're going to get a return on their investment. Is there any way to get those people, okay, I'm going to invest all of this time in you, and then you're going to stick around, right? Are you going to stick around? Who knows? How long is that going to be? 2 years, 5 years? Are you going to sign a no compete clause? What is that going to look like? And so I think that it is something, if people are able to get into one, since there are so few of them, that it's absolutely invaluable, wonderful experience. But is it something that we can actually create and utilize is a whole nother conversation. And I think that there are other ways we should be looking at it. I think there should be student-run clinics. I think that there should be other things that we could do where we could build it kind of into the education system and not rely on the institutions to then continue the education. That further residencies and fellowships should be more specialty. And I think that that would be very beneficial for any specialty, because I feel like a lot, and I'm sorry, this is a tangent, but I feel like a lot of specialty practices who have never hired nurse practitioners before decide this is something that would financially benefit us, so let's hire one, and then they don't know how to train them. They don't know how to get them to focus on subspecialty, and you're really kind of relying on the work ethic of that nurse practitioner to then teach themselves. And that's a burden on the nurse practitioner, who's then just done all this schooling and then has to take extra time to catch up to a subspecialty. And so it's a double-edged sword. And I think that that we're going to have to be very creative in finding solutions for these issues. I hope that answered the question.
It definitely did. Thank you.
Yeah, that was a great differentiation between nursing and medicine. Our role is completely different, and a lot of times there's that lack of understanding from physicians, just because this is a newer role, and maybe they've never trained with nurse practitioners. So yeah, great points. Another question. What do you think about the current nurse practitioner preceptor shortage?
So I think that this is multifactorial, and it is incredibly sad. But at the same time, I think that it is unrealistic to sit back and expect people of their own good heart and will to take people under their wings. I usually, most of the time, have a student with me every semester from different schools. But what I've discovered through that experience is that there are some schools that consistently don't have as strong a student, and I don't have the time to spend with them. And there are some times where I don't necessarily want a student that's not in their last or near their last semester, because what I do is so intense and my patients are so complex. And then I'm blessed to have an office space, and I have friends who they don't have an office space, or they have a very, very tiny closet of an office. And what incentive are they getting? I mean, Georgia finally initiated in 2020 the preceptor tax incentive program, the PTIP program. So you can actually get a state tax reduction, or for when you precept, but you have to be precepting students from a state school. It can be a private school. It doesn't have to be a public school, but it has to be a school that has a physical building in the state. So I can't be precepting someone from UAB or Chamberlain or Walden and get the tax credit. It has to be someone from Georgia State or Mercer or Emory or places like that. And so that's a benefit. That's great, but so far that's the only one, and it's the only one that's been around for only a couple of years. So what other benefits could we give? Schools argue that they cannot pay preceptors. They can't pay certain money. They'll have certain clinics that they'll have contracts with, or certain hospitals that they'll have contracts with. Like any school that has an undergrad nursing program, and also a graduate nursing program, usually has contracts, because that's how they cover themselves with liability insurance. But a lot of institutions want to get paid, and a lot of preceptors then want to get paid, and nursing programs don't have the finances for that. So I think another way that they could overcome that is, could you give the name of adjunct faculty, or could you give a stipend of even just $100? Or there has to be other ways to do it besides just expecting people to volunteer their time. There has to be more than what we're doing. Part of the problem is that schools are over accepting students. Now that we've expanded to online education, schools don't have to say, well, we only have preceptors at 10 places, so we're only going to accept 10 students this semester. Now they can accept 30 and say, well, I hope you find a clinic near where you live, since you don't live near this school. And it's income for the school, but it's not necessarily beneficial for the students. And as we talk in leadership and in academia, how do we tighten this up? How do we make this better? It's a very difficult thing to wrap our hands around, because it's very fluid. It's all ever evolving. And so I think that it's multifactorial at the end of the day. And we're going to have to start giving preceptors more incentives. And we're going to have to start looking at what schools are doing when they're accepting students. And those changes are coming. They're coming. It's been something that people have been talking about for a long time, but they're going to be coming in the next couple of years, because ultimately we're getting too much pushback from the medical profession for losing bedside nurses, for having too many online programs, things that medical schools don't have. And in my perspective, I think, well, nursing, we're always the ones that are evolving. We're always the ones that, where's the need? Let's meet the need. So it's amazing that we have online programs. People still have to do clinicals in person. It's not like people are doing sim lab for nurse practitioners for 2 years. Like, that's not happening. So anyway, that was a tangent, but the answer is that it's multifactorial, and there are lots of different places that we need to answer it, and expecting people to just volunteer themselves is not appropriate. A lot of institutions don't allow people to take preceptors. And so that's another thing that we're going to have to bridge that gap, because it makes you less productive. And so how do we give institutions incentives? Is there a way we could do a tax credit for institutions? Stuff like that. Here.
I think you offered some great suggestions. Even like, as when I was in school, some of my preceptors actually doubled up on students. And you could definitely tell, it's pretty taxing, because not only are you still kind of, going through your patients, even though like we're helping, they still have to think it through as well. And, they have to explain things on top of that. So I think that's some great ideas right there. So do you have any tips for for new grad NPs?
Yes.
What are your tips?
So especially in the state of Georgia, we're a restricted practice state, so jobs are limited. I think, people call it the market saturated. That I think the number is like 129% or 130% of what we actually need as far as job creation. But the reason there's no job creation is we have to rely on physicians and organizations that hire physicians in order to create jobs, because we have to have a collaborative agreement, and you can only have so many nurse practitioners per physician. So that's limiting in and of itself, which doesn't make any sense. Like, if you have a trained healthcare group, why are you not utilizing them? So for new grad NPs, just know, even though the market is tough, network, meet people, go join local organizations like UAPRN and GINA, and meet people and have a business card or whatever the new phone drop stuff is that you can do. Make sure your LinkedIn page is up to date. That's really, really, really big. I know some people still go, what, LinkedIn? And I'm like, yes, it is its own thing now. And make sure it's up to date. Make sure if you do anything, you're posting it there. Don't just sit and mellow. You need to make sure you're being well-rounded, you're active, you're volunteering. It doesn't have to just be in clinics. It can be with I'm losing my mind. It can be out in the community without even doing something healthcare related, just volunteering your time, making sure that you are making people aware. I'm investing in the community. Get published. Go back to your alma mater and ask if there's some adjunct faculty work you could do. There's always something. Sometimes there are locums jobs. Sometimes that's a little too much for a new grad, but there's always something. There's PRN positions. For those of you in the Metro Atlanta area, I know that Wellstar has a practice growth program where they hire new grad NPs to work as a bedside nurse, but then they have them shadow different providers and then eventually work up to where they're working in clinics. And it might be just one day a week, but that first year, you're getting all this mentorship, you're getting all this input, which is really amazing. I mean, I just found out about this program today and I love it. And I think that this is something that a lot of larger institutions should utilize because it makes sense. This is how we bridge you from RN to NP, from bedside to provider, and it's overwhelming if you actually are one of those people who graduate and you get your first job and you're just in it full time and you're like, wow, this is so overwhelming. It is lonely. It is so lonely to go from you have your group that you know who can help you turn and who you can ask questions of, and to nothing. You're your own resource. And so building up for that, figuring out who your resources are, reaching out to the community. For my first job, I figured out who the radiologist would be that would be reading the films for the day. And I would call them, can you read this chest x-ray right now? Because I think I see something and I'm not sure. Or I figured out the orthopedist down the road. Hey, I have a patient that I might refer to you, so that's income for them. But I'm not sure, this is their presentation. This is what the radiologist said, blah, blah, blah. And then they would say, oh, you know what? That's not actually an appropriate referral, but thank you so much for calling me. So it was amazing how, you build up your connections and you figure out who you can ask questions of, and how you can overcome difficult situations and learning. And it's amazing. I've only had one physician that first rotation that was actually really rude to me, and he was an ER doc that I didn't even call. He went out of his way to call me, but everybody else, which didn't make any sense, but everybody else was very receptive to, okay, this is my primary care person who's going to be seeing patients and referring patients to me. I want them to be appropriate referrals. I want them to send patients my way, but it also be worth my time. And so that those are some of the things I think about when I think about advice for new grads.
Those are all really great tips. Thank you for giving us your insight into the transition from, nurse to NP. This has been great. Thank you, Ashley.
Thank you.
So for everyone tuning in, please join us all week long as we meet another NP leader. We'll be giving away more fun raffle prizes and honoring our nurse practitioners. Make sure you take a picture of yourself in your white coat and tag us at GINA Georgia on Facebook with the hashtag GINA Wears White. We'd love to honor you. And that's it for today.
Thank you so much. I really appreciate y'all.
Thank you, Ashley. Happy Nurse Practitioner Week.
Thank you. You too. Bye.
Bye.